So the facelift involves tightening the deep structures and the skin in the face in order to address laxity in the face and the neck. And so it's done by an incision that runs along the front of the ear and behind the ear. And then that allows the surgeon access to the deeper structures, which are then tightened. And then the skin, once the deep structures are tightened, is redraped and any excess skin is taken out. The facelift addresses only laxity. And if the asymmetry is as a result of the laxity in the soft tissues, then it can play a part in addressing some of that asymmetry. But if the asymmetry is as a result of bony asymmetry or the result of volume asymmetry, i.e. one of the sides of the face is more full than the other, then it's unable to do that. So the SMAS or the SMAS is the tissue that separates the superficial aspects of the face from the deeper aspect, i.e. the muscles, the ligaments, and where the facial nerve runs. And there are two ways to address the loosening or the laxity in this fascia or this tissue. One is to tighten it using sutures, i.e. You do not cut it, but what you do is you imbricate it, i.e. you suture it on top of each other so that it becomes tight. The deep plane facelifts believes that you have to go underneath this tissue and then pull it, releasing some of the deeper structures from it, and then restitch it. The difference between the two is related to the longevity of the results, i.e. it's believed that the deep plane facelift lasts longer, the results, between 10 and 12 years. The tightening the SMAS lasts between 6 to 10 years. But on the other side, the downtime that's a result of the deep plane facelift is much higher. The swelling post-operatively associated with that is much higher than with a procedure that does the tightening, i.e. patients with the tightening of the SMAS will be able to go back to work after a week, whereas those who've had a deep plane facelift really are looking at 2 to 3 weeks out of work and a further 8 to 10 weeks of swelling. So in order to properly assess which combination of procedures one needs to understand that the face is like a cake. There's the surface, then there's the volume, and then there's the base of the cake. And so the surface is the quality of the skin, discoloration, sun damage, loss of elasticity. Then there's the volume, which is the loss of facial fat and loss of volume in the face. And then the deep structure laxity, which is what the facelift addresses. The issue is that the facelift will only address laxity. And so patients who have problems with the surface, i.e. the skin, or with the volume, will need volume replacement or skin rejuvenation or skin resurfacing. And so we can combine it with fat transfer if we want to replace some of the fat. We can combine it with some of the resurfacing procedures such as laser or radiofrequency if we want to address the skin surface. So the side effects after surgery, the most common is the swelling and the bruising. Some patients have a sensation of numbness in the ear, especially the lower half of the ear, and a sense of tightness as a result of tightening all the deep structure. The length that this swelling lasts depends on the procedure and on the patient. and the numbness will last between 6 to 9 weeks after. There are scars, and these scars run, as everybody knows, where the facelift scars are, in front of the ear and behind the ear. Initially, these scars are red, depending on the skin type. Then they start to subside and go down. And effectively, the color mismatch of the scar with the surrounding skin will take between 6 months to 18 months to completely become like a white, thin scar. With regards to the swelling, depending on the procedure, whether it's a SMAS tightening procedure or a deep plane procedure, swelling might, in the SMAS tightening procedure, last in terms of being away from work a week, and then what we call, kind of red carpet ready, 4 to 6 weeks. Whereas with the deep plane procedure, return to work is more 3 weeks to 4 weeks, and full swelling up to 10 weeks. Facelift results, basically the facelift will address laxity. And so the idea is that it returns the kind of crispness to the angles of the chin, the neck, the nasolabial lines should be pulled and effaced. And that kind of laxity is addressed by the facelift.